We have heard a lot about the ICU, but do you know what is actually inside of an ICU? Ciao everyone, I'm Gianluca, your OT equipment specialist, and this one is Equipment for Independence channel. First of all, I want to say a huge thanks to doctors, nurses, and everyone who has been saving lives during this COVID-19 pandemic. In this video, I will talk about the equipment that you can find inside of an ICU. I hope that you will never have to use it, so get vaxxed. This is a typical ICU. On our left side, you can see a resuscitator bag. These bags are used to inflate the lungs during procedures including intubation. Moving on the right side, we can see the syringe pump. A syringe pump is a sophisticated pump used to deliver small quantities of intravenous medication and fluids. Of course, we cannot fail to see an hospital bed. The beds used in an ICU are specifically designed to be able to meet the unique needs of critically ill patients. Some beds are equipped with a pressure-relieving mattress. This is a special mattress that patients use when they are at high risk developing pressure sores. Attached on the bed, there is a sequential compression device. Sequential compression devices are used in intensive care to reduce the risk of deep vein thrombosis in the lower limbs of critical ill patients. Deep vein thrombosis are a serious complication associated with being immobile for a period of time. Moving on top of the bed, we have different tubes. Basically, they give us some nutrients and oxygen based on their function and their location. For example, we have the central venous catheter, which is an intravenous line that is used for giving the patient fluids and/or medication. Then we have the nasogastric tubes. A nasogastric tube is a flexible plastic tube that goes through the patient's mouth or nose into the stomach. The NG tubes is secured into the place by tape. It has two main purposes: to remove body fluids from the stomach to prevent vomiting, to give food and medication when the patient is ventilated. Breathing tube. The breathing tube is a long plastic tube used during invasive ventilation. The tube is interplaced through the mouth, down through the throat and into the lungs during intubation. The external end of the tube is attached to a specific tubing which is connected to a ventilator. Yes, I know, probably you made my same expression. Blood pressure cuff. Critically ill patient needs to have their blood pressure checked regularly. Saturation monitor. This is a device that measures the oxygen saturation level in the patient's blood. Indwelling urinary catheter. Well, we know what is it about and where it goes. I think that nobody likes it. Ventilator. Ventilators are commonly known as breathing machines because they support patients to breathe for themselves, or can take over breathing for patients completely. ICU bedside monitors. All patients admitted to the ICU are connected to the bedside monitor during the stay. The ICU monitor, which looks like a television or computer screen, provides ICU staff with real-time information on important vital functions such as heart rate and rhythm, blood pressure, body temperature, breathing rate, and oxygen saturation. Thank you so much for watching. I know that today's topic was really deep. I hope you liked the video. If so, subscribe to my channel, leave a comment. Thank you so much and arrivederci.